So we're moving on to the next session, and we'll have a break right after the next session. So next up, we have Dr. Elissa Thompson. Dr. Thompson is a cardiologist with Cape Cod Healthcare and practices at the Cardiovascular Center in Hyannis and the Fontaine Outpatient Center in Harwich. Dr. Thompson attended the University of Maryland Medical School, completed her residency in internal medicine, and her fellowship in cardiovascular disease at the Washington Hospital Center, Georgetown University Hospital. Dr. Thompson is certified by the American Board of Cardiovascular Disease. She's also the director of Healthy Parks, Healthy People program, which is a wellness initiative of Cape Cod Healthcare in partnership with the Cape Cod National Seashore. Today, Dr. Thompson will speak about nutrition and cardiovascular disease. So without further ado, thanks.
Thank you. Thank you all so much for coming. I know this is a long day, but it's so great to be able to see so many people in this room again this year. I want to thank again Dr. Siddhartha for having the brightest idea ever to get people from Cape Cod together to talk about public health issues, things that affect all of us, not only as mothers, fathers, sisters, brothers, spouses, taxpayers, patients. We're all, in one way or another, those people that I just mentioned. I want to thank Dr. Siddhartha because I've been able to participate in this since the inception of this program, which has been fantastic. As a cardiologist, I loved Amy's comment about the teacher and the student. For me, as a cardiologist, I think many of my patients will feel it's like going to the principal's office, so that's a lot different, and I'm unfortunately occupying that position very frequently, but I want to let you know that as a student in that sense, when I was here last year, I became the student, and I definitely realized, even after my many years of participation in wellness trails, that plant-based was the way that I needed to go. And I had been moving in that direction for several years, but wasn't feeling good and wasn't losing weight and wasn't being able to do my laundry the way I wanted to because I couldn't bend over. So I became a vegan last January, and then I started working with Amy's partner, Lisa, last January, and I have never, ever felt better in my life. And I would attest to that. One of the specific examples that I can use, and I think it's an important thing because not all of us are going to be marathoners or major long-distance athletes, but most of us like to think clearly. And this year marked the 10th year of my graduation from my fellowship in cardiovascular medicine. So every 10 years we're required to recertify, which is always so much fun. And that required me to take many different educational after-school activities, but I also took a week off of work and had to study. And I've been studying since I was in kindergarten. I've taken a lot of tests. I've done a lot of really amazing things academically, and I'm used to taking tests, and I was really loathing this for about the past 3 years. And I'll tell you what, I took a week off, I sat and I studied 8 hours a day, which wasn't very healthy, I noticed it, and that's another story. But I did. I sat 8 hours a day for a solid week, and I studied, and I never wavered from my mission. I didn't play solitaire on my iPhone like I usually do when I'm bored. I didn't get up and fold laundry or clean my children's rooms. I did what I set out to do every day, which was to study. And I passed, and it was great. But I told my thank you, yay. And I did very well. But the point that I'm trying to make is I've never thought with such clarity. I've never had such direction. And I'm a goal-oriented, clear-thinking, highly functionally active person in my career. I've never felt that way. And I know I owe that 100% to my plant-based diet. So I do what I say. And when I tell you, if you're one of my patients or if you're just listening, this really has an impact on every part of your physiology. And so that's why I'm always excited to talk about it, because not only have I always known this since I was in medical school, but now I've grown to the point where I have embraced it completely, and I'm very excited about it. So moving on, I got this right. Oh, no, sorry, I did it wrong. So This is my slide from last year. This is the slide that I could have, if I were alive in 1950, I could have shown you in 1950. And unfortunately, I don't have my pointer. No. Oh, okay, sorry. Oop, going back. I don't have my glasses on. That's the one thing it didn't correct. Sorry. So, oh, got it. I got it. Sorry. So this is 1950 over here, where the pointer is. And this goes up to 2014. The top line is heart disease death. The bottom line is death from cancer. You can see that since 1950, cardiovascular disease has killed more people than every cancer killing every man, woman, and child combined. And that's still the case. Cancer's getting worse, unfortunately. Heart disease is sort of, on average, about the same, but it's still the #1 killer, and it's the #1 killer with a bullet. And like I said, unfortunately, I'm like the principal, and people have to come to my office after a lot of things have been tried and not worked. And when people have symptomatic atherosclerotic disease. And going back to a few things that Dr. Siddhartha mentioned, he's talking about inflammation. And my disease is a disease of inflammation. There are many things that we do and not do, and eat and not eat every day that lead to chronic systemic inflammation. And the disease that I treat, among many diseases, I mean, coronary artery disease is the main disease that I treat, but to a certain extent, valvular heart disease and arrhythmogenic heart disease and cardiovascular disease in the carotid system, as well as the lower extremity arterial beds, are about 80% of those things are 100% based on what we eat. And so it's of the utmost importance that we talk about nutrition and food value, but we only get 15 minutes to spend with a patient. And if we're talking about their statin and their blood pressure and their aspirin and their symptoms, we don't get to talk about these things, yet it's the most important thing. As we all know now, dietary practices have a significant impact on your health. Obesity is an epidemic in our country. Somebody asked a question earlier, is sugar the new tobacco? Sugar and processed sugars and simple sugars, not dietary sugars like the sugars that are in fruits and vegetables, among other things. But added sugars are incredibly impactful to us as a society because we have an obesity epidemic and therefore a diabetes epidemic. Obesity is characterized by a body mass index that's greater than 30. So I encourage you, if you do not already know what your body mass index is, to figure it out when you get home tonight. You need to know how tall you are, and you need to know how much you weigh. And then you need to know how to Google things. And all I want you to do is Google up body mass index calculator. And there's a calculator that'll come right up. Insert your height, insert your weight, and that'll give you what your body mass index is. If your body mass index is over 25, you're overweight. If your body mass index is over 30, you're obese. More than 90% of my patients have a body mass index that's over 25. Most of my patients are overweight and obese, and that drives almost every other single disease process that they have, including diabetes, high cholesterol, and hypertension. Visceral fat, which is something that we don't often talk about. There's this fat, our bingo flap fat, and then there's visceral fat. Visceral fat is the fat that is contained in the peritoneum, which is the sac that surrounds all of your gut organs, your spleen, your stomach, your liver, your pancreas, your gallbladder, etc. That fat that develops and that we know you have if, in fact, your body mass index is greater than 25, that fat is highly metabolically active, and it secretes hormones that do not allow us to appropriately regulate insulin and glucose, do not allow our livers to appropriately metabolize and digest our food, do not allow endothelial cell function to appropriately take place. The endothelial cells are the cells that are the lining of all of the arteries in our body. And they are highly metabolically active, and they are what we're going to talk about when we talk about cardiovascular disease, because that cell layer is its own organ. And this visceral fat pad is secreting hormones that don't allow that endothelium to work correctly. And when it doesn't work correctly, cholesterol particles, triglycerides, very low density lipoproteins and LDL particles will migrate into the layers of the artery walls and cause plaque development. And ultimately, that plaque can rupture and cause heart attacks and strokes, among other things. So why a plant-based diet? So I like this slide as well because we know that vegan arteries work appropriately. They have 3 cell layers that are muscular. The endothelium, which is this inside lining, works appropriately. People who are vegetarian, we know, have much more development of plaque. Plaque, again, the development of plaque is a lifelong inflammatory process that occurs for decades before you end up going to the cardiologist or in the cath lab or having a bypass surgery. We know that people who have animal fat and animal protein in their diets do have some degree of plaque development. And then people who eat excessive amounts of animal fat and animal protein. And when I say excessive, I don't mean a big steak on Friday night. I mean that pyramid that Dr. Siddhartha was talking about, like vegetables, fruits, nuts. Most of us don't eat that way. Most of us eat this way. So the things that we shouldn't be eating the most, such as added sugars and meats, are this way, and we're eating very little amounts of fruits and vegetables. So we know that people who eat that way have much more development of plaque. And I think it's an important thing to remember at this time, because not a lot of people understand the development of cardiovascular disease. Even if you have a little bit of stenosis, if you were to go to the cath lab per se, like you had chest pain, you ended up in the hospital, they took you to the cath lab and they injected dye into your coronary arteries. What we can see on that test is just that there's a little bit of blockage, perhaps a lot of blockage, that we can put a stent in or bypass. But it doesn't tell you the full extent of this disease. And this illustration is a good one in the sense that what I need people to understand is that atherosclerosis exists throughout the entirety of the vasculature. So if you have a little bit of plaque that can be seen on an angiogram, you have a lot of plaque that is throughout the walls of the arteries. And that's why cardiologists talk about diet and talk about exercise and talk about drugs. And that's kind of where the drugs come from, is what we want to do is make sure that we're treating this so it doesn't progress. Because we have to treat the inflammation with diet, with exercise, and unfortunately oftentimes with drugs. So going back to our subject of dietary, of dietary restriction of animal fats and animal proteins, or hopefully going toward a plant-based diet, it's dairy, red meat, eggs, sodium, added sugars that injure or impair the function of this arterial vasculature. The inflammation that's caused by ingestion of and digestion of these products causes decreased nitric oxide production. Nitric oxide, if any of you know anyone who has to take nitroglycerin, or if any of you had a parent who had to take heart pills, the nitroglycerin, they put it under their tongue because they were getting chest pain. Nitroglycerin those pills get broken down in a chemical reaction to form nitric oxide. Nitric oxide is something that we make on our own every day. If you exercise, you are creating nitric oxide. The more you exercise, the more nitric oxide you make, the higher the concentrations of the nitric oxide. The more nitric oxide that is circulating in your body acts as a significant anti-inflammatory and an antioxidant. So if you decrease your nitric oxide production, you are decreasing the most protective chemical that you can make on your own to protect your artery walls from developing plaque. If these plaques do develop, you can have a myocardial infarction, which is when this plaque ruptures. The core, the foam cells that are cholesterol particles that have been partially digested by your immune system will leak out into the bloodstream. The platelets in your bloodstream will respond to the chemical signals that they're sensing. They will activate, they will send out receptors that will activate and aggregate other platelets. They will form very quickly a block or a thrombus, which is a type of blood clot that will block all flow, and that's what a heart attack is. And if it happens in your brain, that's a stroke. I want to take a brief moment to talk about your gut biome, because everything that we eat isn't just digested by our gut. There are many things that we eat that can't be digested by our gut. And the gut is where most of our immune system resides. It's the interface between the outside and the inside world. And so our immune system is highly active at the level of the gut wall. The human gut biome is a very sort of recent area of a lot of research, because we know that the chemicals and the biochemical reactions that go on in the gut biome are very impactful to our health. The healthy human gut contains about 1,000 different species of various bacteria and viruses. Gut microbes that live in your gut biome will digest things that you can't digest. They will digest things that you have already digested. And whenever they digest these things, they make byproducts as well. And those byproducts are highly inflammatory in certain circumstances and can also be highly protective to our overall health. So it's important to understand a little bit about why we talk about diet so frequently, is because what you eat is what you are. I just want to take a moment to talk about TMAO. I apologize, the slides were, there's another slide that's going to come in here, and it's my fault. But either way, TMAO, trimethylamine N oxide, is a product of the digestion of lecithin. Lecithin is common in things like egg yolks. It's common in soy products. We can't digest it, but our gut biome is responsible for the digestion of the lecithin. When we digest, or when our gut biome digests lecithin, TMAO is created. Now, we talked about soybeans, we've talked about, it happens in natural things, but it's also in a lot of things as an emulsifier or a thickener. So I have a lot of patients who come to me and say, well, I only eat 1% milk or 2% milk. Look on the label of your 1% or 2% milk. What that is whole milk that has been overprocessed, all of the fat removed, and lecithin put in so it doesn't taste just like water on your tongue. So we get a lot, I have a lot of patients say, I don't touch soy. I never touch soy because there's lecithin in that. And I think it's important to understand that there's a qualitative and a quantitative difference between where you get your lecithin from. Are you getting it from processed foods? Are you getting it from exclusively animal-based products? Or are you getting it from vegetable-based products, and how much of it is in your system? Needless to say, when your body creates TMAO, it increases your risk for cardiovascular events, because it alters the metabolism of cholesterol in your intestine, your liver, and at the level of the artery walls. Healthy human volunteers who maintain a vegan diet do not demonstrate increased plasma TMAO levels after a dietary choline challenge or a dietary lecithin challenge. So if you're vegan and you were participating in this study, what they would do is give you a lecithin challenge, and it wouldn't be it would just be sort of there's lecithins in everything. So they would give them this challenge and then check their levels of TMAO. We know that the gut biome of vegans is actually different than the gut biome of people who are vegetarian or who are carnivores. So there's actually something to be said for being a vegan, because it actually alters the way that your gut biome handles the lecithin that's in your dietary selections, such as soybeans, but it does not allow you to create increased TMAO. This is just a slide to show you where lecithin, choline, carnitine, phosphatidylcholine, it comes in a variety of different names. A lot of bodybuilders will eat choline and L-carnitine. A lot of people add that to their diet because they think it's good, because more is better. It's actually not. It can be very destructive to you. And just, I want to, oops, did it again, sorry. I just want to point this the right way. The most amount of lecithin in our diet is actually here. This big green part is as an emulsifier. There's emulsifiers, and then there's also thickeners. The point of all of this is that vegan or vegetarian diets appear to select against gut flora, that methylcholine carnitine that metabolize methylcholine and carnitine. And vegans have substantially decreased levels of gut bacteria that are capable of converting carnitine to TMAO. So I just want to make sure that you understand, in case there are a lot of people who are self-educated about lecithin, L-carnitine, et cetera, that there are good sources of lecithin, L-carnitine, phosphatidylcholine, and there are bad sources. And that either way, if you are maintaining a plant-based whole food diet, you can change radically your gut biome and change the way that these inflammatory particles work in your body. And the reason I bring that up is because of Caldwell Esselstyn. And Amy was good enough to show his book earlier. Dr. Esselstyn is a cardiologist who was kind of working far beyond his years back in the 80s. Dr. Esselstyn is, like I said, a cardiologist. He had a group of patients who had known coronary artery disease. They had very severe coronary artery disease. They had disease that was being treated maximally with the typical medicines that we use: aspirin, statins, beta blockers, ACE inhibitors, nitrates. Unfortunately, their coronary disease was to a point that they weren't able to live without angina. They had chronic angina, chest pain, despite the fact that they were on maximal medical therapy, despite the fact that they had had stenting or bypass surgery. There was nothing that could be done for these patients. And Dr. Esselstyn, all the way back then, said, all right, you're all going vegan. I'm going to put you on a very restricted diet, and it is a very restricted diet. No animal, no plant, no animal fat, no animal protein. And then he looked at their arteries. And he looked at the arteries in a couple of different ways. This image right here is from Dr. Esselstyn's study, and it was just a few patients, but nonetheless very groundbreaking in the 80s. This is a stress test. This is a nuclear stress test. This is an image that I would receive as a cardiologist on a daily basis. What it's looking at is perfusion. There is a drug called sestamibie that is attached to a radio tracer. This was thallium. Now we use technetium. But either way, sestamibie helps take whatever it's attached to, thallium or technetium, into cells in a flow-directed manner. So cells that have a lot of blood flow to them in the heart get a lot of radioactivity. You can see here, in my world, I see these every day. This should look like a donut. What this is the heart sliced like a loaf of bread. And over here, where the arrow is pointing, is an area where there is no perfusion. I should see brightness all the way around like a donut. This area where there's no perfusion tells me that the myocytes, the myocardium, the heart muscle, in that area is receiving no blood flow. Dr. Esselstyn took this patient, put him or her, I can't remember if this was a male or female, on a strict vegan Esselstyn diet, and then redid the stress test, re-looked at that perfusion. This is the same exact patient. And what you can see is that the perfusion has changed. There's still a small area of decreased perfusion, but overall, blood flow is nearly normal in this heart. He also looked at patients with angiograms. So this is a picture of an angiography of a right coronary artery. On angiography, we see the dye filling the arteries. The arteries should be the caliber of this part of the artery up here. This is a more normal part of the artery. But again, the disease is throughout the walls of the artery, so it's difficult to tell how diseased these arteries are. But the caliber of the artery is normal. As you get down toward the end of the artery, it's much smaller and ragged appearing. He then took that patient, put them on his diet, and rechecked the angiography about 3 months later, and you can see that there's complete vascularization. There's normal flow and normal caliber artery all the way through. This is the exact same patient on maximal medical therapy, but also with an Esselstyn or plant-based whole food diet. So he didn't. The things that I was showing you before about TMAO, or the things that Dr. Siddhartha was mentioning before, all of this new stuff was not available. This biochemistry was not fully and completely understood in 1985 when this was done. But what he did was show that there is a link, and there's a clear link between elimination of animal fat and animal protein from a diet and coronary atherosclerosis and vascular health. I'm going to take a step away, and I always take this opportunity if I can, because this doesn't have to do with animal or plant per se. It has to do with American, which is what we all are. Dietary sodium is a very significant health threat. And if we're talking about diet and cardiovascular health, then I think it's incredibly important for us to discuss dietary sodium. Dietary sodium, unfortunately, sodium itself is a very essential electrolyte, but unfortunately in our country we eat way too much of it. And if we eat a traditional animal-based diet, we're eating far more than we should be. And if you are eating a plant-based whole food diet, then in general, because you're eating whole foods, you're not eating anything processed and you're eating much less sodium. But sodium is a direct actor on vascular health. It is a major contributor to coronary disease. It's a major contributor to cerebral vascular disease and development of dementia, stroke, and sudden death. Hypertension itself, as caused by the effects of sodium, can lead to significant degradation of the integrity of the vascular wall. This is a coronary angiogram from a hypertensive patient. There's no doubt in my mind that this patient also has diabetes, obesity, and high cholesterol, but this patient was a hypertensive patient, and you can see this is the right coronary artery, and this is the left main coronary artery over here, the left anterior descending coronary artery over here, and the circumflex artery. And this is not normal. I don't think you have to be an angiographer or a cardiologist to understand that this is clearly not normal. Normal coronary arteries look like thin wires. This picture demonstrates severe dilation of the arteries. And when we see dilated arteries, it's just about a sign as if we see a stenotic artery or an artery that's much smaller in caliber. It just means that there's been chronic inflammatory changes at the level of the artery walls that are causing the dilation or aneurysm formation in these arteries. And that also can occur in your thoracic aorta. It can occur in your abdominal aorta. It can occur in your peripheral vasculature. It can occur in your cerebral vasculature. So it's something that's very important that we understand the basis of hypertension and its link to dietary sodium. The burden of hypertension in our country is quite high. 80 million Americans over the age of 20 are classified as hypertensive. The goal blood pressure for an American adult is less than 130 over 80 millimeters of mercury. So the other thing that you can do besides calculating your body mass index, if you were to do that this afternoon, is find out what your blood pressure is, with the understanding that your blood pressure changes every hour of the day, depending on what you've eaten, what you've drunk, what you haven't eaten, what you haven't drunk, how much exercise you've done, how much sitting you've done, how much your body mass index is, and how much sodium you are ingesting. About 25% between 20 and 30% of Americans go undiagnosed with hypertension because we don't see our doctors, we don't feel bad, we don't look bad, there's nothing really wrong with us, we're doing our thing. That's why hypertension is called the silent killer. So what we want you to do is know what your blood pressure is. It may be high if you go home, sit down for a little while, check it again. Most people have a blood pressure machine at home, or their neighbors do. If you don't go buy one. Just go to the CVS and check your blood pressure. But it's a really, really important number. If that number consistently is elevated, above 130 over 80 millimeters of mercury, then it's time to talk to your doctor. Maybe you need a blood pressure medication. More importantly is if you can get your dietary and physical activity practice in a better place, you won't need any of that medication. But it's incredibly important to know what your blood pressure is. Like I was saying, salt is in everybody's diet. It's in everything that we eat. Unfortunately, in a typical American diet, 80% of what we eat, 80% of the sodium in what we eat is already in the foods that we eat before we think about salting it. Only about 6% of the sodium in our diet is what we use to cook with when we're putting salt in the water to make our pasta or putting a little sprinkle of salt on top of whatever it is that we've prepared. It's very, very important to get familiar with how much sodium is in something that you're eating, because I can't tell you how many times a day I have patients who say, I never put salt on anything. My blood pressure may be 182 over 105, but I never put salt on anything. Never. There's not even a salt shaker in my house. Where did you eat last night? 99. I went to 99. I had the chicken with shrimp. Oh, really? Let's look that up on Google. That was 4,600 milligrams of sodium, Mrs. Smith. Did you know that? No. And it's very, very, very sneaky in the amount of sodium that we have, because that didn't taste salty, but it was exceedingly high in sodium. So I would implore you, as you think about making dietary changes, one of the simplest things that you could do right now to change your health in a monumental way, as you're moving toward maybe a plant-based whole food diet, is to really examine the sodium in your diet, because more than almost 2 million people on the planet Earth last year died of a disease that was directly related to how much sodium was in their diet. So I think it's really important for us to examine that as we're examining our dietary practices. Dr. Siddhartha mentioned that we're looking at AHA, or American Heart Association, dietary practices in our guidelines. There are recommendations about plant-based whole food diets. There are recommendations about Esselstyn or Pritikin or Ornish diets that we talk about from a cardiovascular standpoint. Some of them are harder to follow than others, and we, as the American College of Cardiology and the American Heart Association, haven't been as stringent as we could have been about mandating plant-based whole food diets. But this is the DASH study, 1997. So this we've known this for a really long time. I started med school in 1998. This is a study that came out, Dietary Approaches to Stop Hypertension, and it looked at dietary practices among different populations of people. People who were plant-based whole food, people who were vegetarian, and people who ate a normal American diet, who got a call once a month during this study that said, eat healthy. So what we determined was that the people who ate the least amount of added sugar and the least amount of animal fat and animal protein had the lowest blood pressure, had the lowest LDL, had the lowest incidence of heart attack, had the lowest incidence of stroke, and had the lowest cardiovascular mortality rate. So this actually still remains the diet that we, as the American College of Cardiology, recommend. If you are going to eat animal, you should eat the DASH diet. Or if you don't want to eat animal, eat the DASH diet without animal. It's that simple. And again, I would point out the similarities. It's lots of fruits, lots of vegetables, whole grains, legumes, and then limited amounts of added sugar, which is also alcohol, by the way, animal fat, animal protein, oils, and nuts. These are the 2015 recommendations, again, from the U.S. Dietary Guidelines Advisory Committee, which educates the American College of Cardiology, the DASH diet, the Mediterranean diet, as Amy was mentioning, that gentleman who lives in Greece. The Mediterranean diet it's not like the South Beach diet per se. It is a practice of eating that we have derived from Mediterranean-based societies, small populations of human beings that live in very remote areas that rely exclusively on the land for what they're eating. They have very limited interaction with animals, and if they do have interaction with animals on their food growing property, it's because the animals are being used for work and not sources of food. So I want you to understand what the Mediterranean diet is. A vegetarian diet, of course, that is like the DASH diet, and then a whole food plant-based diet. So these recommendations, I know we've heard, but this is what our American College of Cardiology recommendations are right now. And that is actually the end of the program. Okay. Sorry. Yeah, fine. So because I didn't see Julie, we are running behind. So we'll do questions later on. I'll defer to Dr. Siddhartha.